Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex to self-love to questions about body parts. Let's get this episode started. Alright, I got some more period questions for you. Okay. Question number 1. Right now, why does my period look watery and thin in consistency and light pink in color? Can it be caused by anemia or poor nutrition? No. Realistically, what your period blood looks like is going to be whatever you're bleeding out of your uterus, mixed with some cervical mucus, and can vary in color depending on the hormones that you're producing, or if you're taking birth control. So having a period, having a heavy blood flow can cause anemia and make you lose a lot of blood. And when it comes to nutrition, poor nutrition or not getting enough calories can cause you to lose your period, but they don't usually cause changes in the way you bleed, if that makes sense. So you can certainly have anemia and poor nutrition and have a period that goes from light pink and watery one day to chunky clots and bright red the next day. It's going to fluctuate depending on a number of other factors not related to anemia or to your nutrition, if that makes sense. Question number 2. Can I stop my period? It makes me dysphoric. So dysphoric means a somewhat of a depressed state. And yes, so naturally there aren't really any consistent or reliable or safe ways to stop your period, but there are definitely safe ways to stop your period if you talk to your doctor, in the form of hormone control or birth control. And specifically, I would recommend continuous birth control pills for you. A great option that give you a continuous, steady state of estrogen and progesterone derivatives to help your body grow, keep your bones growing healthy. But I would recommend probably that for you. There are some other options too, but definitely talk to your doctor. It's not worth feeling down, and periods really aren't necessary, especially if you don't want them. All right, question number 3. I'm 15 and I've had light brown, orangish, watery discharge for 4 days. I don't know if it's my first period, and I'm confused because Google tells me it's an STI, but I'm not sexually active. Don't trust Google. And I don't take medication. I've also had a white, clear discharge for about a year. So this sounds like a textbook first period. It's very normal for the first couple of years of your periods to be brown, orange, pink, red, all sorts of different colors from oxidized blood or old blood, as well as for the schedule to be all over the place. So you might have a little weird bleeding now, another weird bleeding in a month, and then not have anything for 2 months. What I would recommend is always be prepared with some pads, tampons, menstrual cup, whatever you prefer to use, because it will probably turn to blood pretty soon, so just be ready. And also your comment on the discharge. That is also very textbook, to have vaginal discharge for about a year before your first period. So you sound totally normal. Awesome. Question number 4. How do I put in a menstrual cup for the first time? I'm also a virgin and never used tampons. Okay, so this one is going to be good for you for wanting to try. Putting in a menstrual cup really does require some intimacy with your vagina. So being comfortable putting your fingers up there, moving things around. So if you're not quite ready for it, not ready to get a lot of blood on your hands, then maybe back off, try a tampon. But if you are ready, my first recommendation would be figuring out the right size for you. So I'm going to put a link in my description of the episode of a website you can go to figure out which menstrual cup is right for your cervix and your uterus. And that should help you, step number 1, be on a successful path to menstrual cup use. Then when you have your menstrual cup, I would recommend one of two ways to do it. So the first time or few, make sure you're relaxed and in a good position. So you can either do this by laying down on the ground with your legs spread and your knees bent, or in the shower with a leg up. Someone recommended this to me a while ago, but it can actually be easy cleanup. If you're in the shower, you get blood on your hands, you just wash it off. That's great. The insertion technique. So you will have to sort of fold the cup. Menstrual cup. You will have to sort of fold the cup on itself to make it such a way that you can insert it into the vagina. So check this out. So kind of like that. So then once it's in the vagina, it has to sort of pop open around the cervix, and you'll have to sort of put your finger in there and feel around to make sure that things have opened up and deployed, so to speak. But that's it. It's going to take some intimacy, some getting up in there, some blood. But if you're ready for it, go for it. It's a great option. It just takes some getting to know ya. All right, and question number 5. Usually on the first day of my placebo week, my blood is dark red, but this time my period blood is light red. Is this okay or is this a problem? Totally fine. Everyone's period blood can change from day to day, from month to month. That's completely fine. What you're experiencing is just it sometimes lighter red or pink blood can come from mixing with cervical mucus, or if you're taking birth control pills, estrogen levels can make it look a little bit lighter pink, but nothing to worry about. Totally fine. All right, that'll do it for some period questions. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.